Hello, my name is Dr. Asley. I'm a board-certified fellowship-trained spine surgeon. I'm the medical director here in Sacramento Spine Treatment Center. In this segment, I'll be discussing with you a surgery called anterior lumbar fusion. Anterior means from the front, lumbar means lower back, and fusion means turning the two bones that are moving against each other, turning into one bone, eliminating motion and eliminating pain. The indications for the surgeries are continued low back and leg pain because of what we call a degenerative disc disease, or a disc that's a cushion between the two bones has gone bad and deteriorated and is causing this pain. Now, before we go any further, I need to tell you what I feel about that name. That name came when the spine surgery was very young. They would get x-rays and they will see that these discs have deteriorated between the two bones and bones are grinding into each other. Therefore, they called it degenerative disc disease. Now, 30, 40 years later, we have a lot more research, a lot more information, and we have studies like MRI that actually shows the disc, and we realize that these discs, the integrity of these discs are very important, and they can be violated by trauma, like an accident or something that happens to the patient. Therefore, the name needs to change into a damaged disc disease and not a degenerative disc disease, because there is a subpopulation of people that actually they have a disc that is not as strong as the average population, and they're the ones that they have disc that does deteriorate based on daily living. However, those people have discs that are multiple layers are involved, and some of them have relatives that they are suffering from back pain. Those subpopulation, you can call them degenerative disc disease, but the majority of the patients that I treat, if you go back, there's a history of trauma. Something happened to that disc and its integrity got violated, and that's why the disc went bad through the years. It settled and now has become painful. Now, as surgeons, I got to tell you that our job is to avoid surgery. Therefore, when we see a patient that's suffering from low back and leg pain, we'll do whatever we can to avoid surgery. Therefore, we'll try physical therapy, epidural injections, chiropractic care, manipulations, even acupuncture, pain management. And if these fail and patients still suffering from significant amount of low back and leg pain, and we see a solid evidence on the MRI what's causing the problem, then patient is a candidate. Then if the patient decides to have the surgery, then we can proceed with that. Now, the day of surgery, patient comes in, we'll give him antibiotics to decrease the chance of infection. Patient lies down, an incision right over the abdomen is made, and then we go underneath toward the left side and we sweep the abdominal contents toward the right side, therefore approaches toward the left side. Once that happens, we are looking right down into the spine. And this is the example of an anterior lumbar fusion. If you can see right here, we have taken the disc out, and actually most of the times the disc has deteriorated and is collapsed. Therefore, we have these sizers which progressively we are able to jack the disc open and relieve the pressure in the neuroforamina, which their nerves are trying to come out, and relieve the pressure off those nerves, therefore helping the leg pain. And once we jack it open, we can put a piece of prosthesis in there, packed with what we call the BMP sponge, bone morphogenic protein, and a little screw so the prosthesis doesn't get extruded like a watermelon seed. Now, what we have inside that prosthesis, the BMP sponge, bone morphogenic protein, is a hormone that we all have it. When you break your bone, that gets excreted, and that's how you heal it. Within the last 5 to 10 years, they've had that actually isolated in the laboratory. It comes as a product and a sponge that we can put it in the middle of that prosthesis. Therefore, we don't have to go to the hip to get bone grafting. And actually, it increases the fusion very well, the rate of fusion very well. So once we put the prosthesis and the screw, and that is the surgery. If the anterior lumbar fusion is combined with the posterior lumbar fusion, then we take the patient the next day to do the posterior lumbar fusion. And that depends what the pathology is. If the anterior lumbar fusion is a standalone by itself, then the patient gets admitted to the floor, stays in the hospital for about 2 to 3 days, and gets discharged after the abdominal function comes back. To do the surgery, we like to give our patients GoLikely, which is a fluid that they drink the day before the surgery, right around 2 to 3 p.m. So by 9 to 10 p.m., their intestinal contents are cleaned up. Why? Because when we manipulate the intestines, if they're empty, the function returns much quicker. And of course, our job is a lot easier. Once they go home 2 to 3 days after surgery, patients should be able to get around the house, go to the kitchen, fix a sandwich, go to the mailbox. By 2 weeks, when the patient comes back to see me to take the staples out, patients should be comfortable enough to get around the block, a small city block, and the pain will get better and better throughout the months. Now, it takes about 5 to 6 months to bone grow between the bone above and bone below and solidify through the middle of that prosthesis where that BMP sponge was. Therefore, the post-op instructions for the patients are very important because sometimes 3 to 4 months after surgery, patient's pain is very good. Patient's not suffering from much pain. Therefore, they want to increase their activity. But I have to tell them that no, even though you feel fine, you're not healed. And if you jar this, if you increase your activity, you will stop the bone formation here and you end up with a non-union. Therefore, we have to redo the surgery, which is very difficult. Therefore, following post-op instructions are very important. I hope you enjoyed this segment, and on the next segment, I'll be discussing with you posterior lumbar fusion. Have a nice day.